So we're going to do a couple of minutes here on fibromyalgia and depression. That could be an exhaustive subject, but we're going to take one particular aspect of it. I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner, also a chiropractor for 36 years. This is my sidekick,
Dr. Randall Gates. I'm a board-certified chiropractic neurologist as well as being a chiropractor.
And we have what has ultimately developed into a chronic pain practice. We have melded our two disciplines. They are very distinct and separate disciplines of working with the brain and the nervous system and stress mechanisms, and working with basically all the other physiology of the body and functional medicine, and indeed even the physiology of the brain. But in putting those two together, we feel that diagnostically and physiologically, we basically cover all the bases of the types of things that create all these various chronic pain syndromes, fibromyalgia being one of the most prominent. So Dr. Gates does a lot of research for us in this facility, and he wanted to talk about the aspect of depression and fibromyalgia. And we're just having a little discussion beforehand in which I was saying, is there anybody that comes in here with fibromyalgia who doesn't have depression? I mean, very seldom do we ever have somebody come in here, and there's so many different things that can cause it. Just having fibromyalgia and going to doctor after doctor after doctor and being told we don't know what it is, you need to go see a psychiatrist, there's nothing get done for you, you got to take these opiates for us. That's depressing, and I'm not joking. That creates depression a lot of times. Once a person starts getting better, that particular type of a depression can lift. But Dr. Gates wanted to talk about some more interesting things that I find more interesting, because one of the things that I got when I got into this field after a short period of time was it made me a lot less judgmental about people, because you started realizing that people were depressed didn't need to just pull up their bootstraps. You started finding out that there was significant physiological reasons for the part of their brain that creates depression to create that depression. And Dr. Gates is going to talk about one of the newer, cooler findings on it.
Mm-hmm. So and as you alluded to, a lot of the patients that come to this clinic who have fibromyalgia have depression. We just did our fibromyalgia update part 2, which is really, now thinking about it, part 3, because we did the first one back in January. We did one last week and then another one this week, because there's so much data on fibromyalgia that's coming out all the time, and you really got to be up on the newest of the newest stuff. And other things go along with fibromyalgia aside from depression, like irritable bowel syndrome, migraine headaches, interstitial cystitis, which is where you feel like you have to pee all the time, but you don't have a urinary tract infection in essence, things of that nature. Relative to depression, though, one of the things that really piqued my curiosity is an article or something that they cited in Kelly's book of rheumatology. It's the gold standard book in rheumatology, talking about how fibromyalgia patients have these antibodies to serotonin. So serotonin is a neurotransmitter in our brain, commonly termed a good neurotransmitter. Makes you feel good. And they saw that fibromyalgia patients were making all sorts of antibodies, which are immune cells, that were attacking the serotonin. And so it's no surprise that one of the most effective therapies for fibromyalgia patients, not only in terms of depression, but also their pain, is to take medications that increase serotonin in their system. And possibly it's because the immune system is killing that serotonin, amongst many other reasons. And we can't go into all those reasons, but we recommend you watch our lectures or videos on fibromyalgia, including the one today. So that was really important. And then I just pulled up an article from Journal of Affective Disorder 2012, where they were talking about how even in just the average depressed subject, and we don't mean that in a denigrative fashion at all, half of them had serotonin antibodies. So this is something that's not really commonly talked about, but it's a big deal. I mean, half have antibodies to serotonin.
And the reason that that's important is because for those of you who haven't seen any of our things, there's a group of base conditions that we see in virtually almost every fibromyalgia patient that comes in here. One of them is almost everyone of them has an autoimmune component.
Right.
So if you have an autoimmune problem, what that means is at some point your immune system decided that you were the enemy and started to attack your healthy tissues. The big ones that we see, and we're probably going to start becoming more aware of others now, like this particular situation. The big attacks that we see are on the thyroid, which creates something called Hashimoto's, and there's a lot more to that than maybe just an attack on a thyroid. We see big attacks on the gut. We see attacks on the cerebellum. Those of you who get dizziness, vertigo, balance, and that type of stuff. And this is one more tissue that could be getting attacked, that could be explaining one more symptom in the clinical picture of fibromyalgia. And to go further, that means that if you had all four of those things, you really have one problem. Your problem is really your immune system. And so that's kind of an interesting thing that we found in fibromyalgia. People come in with like 100 different symptoms, but they really have maybe 3 or 4 or 5 main issues that are creeping out and affecting all of them. But this serotonin thing, I think, is big.
It's huge, yeah.
Because I said, well, I am going to say it. Well, most of our patients that come in for depression, I'll be very careful as to how I say it. Not in case I'm going to get anybody in trouble. But the fact of the matter is I do all the consults, I do all the intakes, I do all the screenings as to what patients look like they might do well or not do well in our program. And virtually everybody has depression who comes in here with fibromyalgia. We have a little initial history. People check the little box. Everybody checks depression. If they don't have to check depression, I say, did you miss this box? And most of the time they'll go, well, yeah, I'm kind of depressed, but you'd be depressed too if you had this. And that's true. But in the end, the vast majority of those people see various degrees of improvement in their depression. Is that better?
That's a better way to say it.
Various degrees of improvement in their depression, not taking and getting off of or reducing their antidepressants and so on and so forth by going through the different types of procedures that will handle, in this particular case, their immune system.
Right.
That's all I have to say.
And as you alluded to, lots of times people will say, well, if you had this much pain, like you said, then you'd be depressed too. We talked in our other videos extensively about the effects of stress in the fibromyalgia patient population. Those stress hormones can be associated with depression as well. If you need further information on
we'll probably just do a whole thing on depression.
Yeah, we need to do it. Dr. Sapolsky did an hour-long thing on depression. If you type in Rob Sapolsky, depression into YouTube, you'll see a great hour-long video there. Yeah, and it was fantastic. He's the world's foremost researcher on stress. But in essence, yes, depression is very common in fibromyalgia patients. Know that maybe your immune system, I was just off in dreamland there for a few seconds while you're talking about the immune system, because who would ever thought that our practice would be so based in the immune system? And the thing is, when you treat chronic neurological illness, chronic pain syndrome patients, all the data is going towards the immune system. 1 out of 6 patients, or 1 out of 6 people in this population in America are thought to have an autoimmune disorder. Those are some of the statistics. It varies, but basically that's really common. 1 out of 6. So pretty much everybody knows somebody with an autoimmune disorder. Which means it's probably more. Probably. Which means it's probably more. And so that's what we have to say about fibromyalgia and depression. Yeah. If you have any other questions, you can go to www.powerhealthtalk.com. You can contact us on our Facebook page, and that should take care of it. Thank you for watching.